So in today's class, we are going to see a case study. Okay. So what is the first unit? Puberty. Yes. So with relation to our puberty unit 1, we will see a case study. Okay. So what puberty lesson consists of?
Changes in
Yes, standard.
changes in body,
Yes.
in their behavior.
Okay. Yes, okay, very good. So this puberty phase is a critical transition phase, right? So from childhood to adolescence, there will be a transition, right? So in between, a phase called puberty occurs. So what is the age of puberty? 11 to 15. Okay, yes. 11 to 15 in girls and in boys? Yes, 12 to 14. Okay, yes. So the during this puberty phase, we have a major developmental growth, right? So that can be a physical rapid growth in physical development like height, weight, strength, body proportions. All these will have a prominent growth. Likewise, we also have emotional changes, and which all happens due to hormonal effects, right? So these are like a basic concept what we will see in this puberty. So with link to it, we will discuss a case study. Okay. So as you all know, a basic of what is conduct disorder, right? You all know, right? Yes. Okay. So conduct disorder is nothing but it manifests in the period of between childhood and adolescence. So we all know that this is the period where there is a prominent growth, right? So during this period, there is a growth in there will be a gradual growth in our prefrontal cortex, which manages our executive functions like problem solving, decision making, and all. But there will be like prominent growth. This executive functions will be in a less. It has a it gradually increases in growth. Okay. Whereas when we see limbic system, it grows. It has already developed in this stage. So which deals with emotions and impulse control. Okay. So here in this stage, like puberty stage, there will be a misbalance, like imbalance in this prefrontal cortex growth and the limbic system growth. Okay. So as there is an imbalance in development of this executive functions and limbic system, during this phase, these children will face like they won't have a proper development of their emotions, so they will go into impulsive activities, right? So only because of these reasons, like the society won't let us to drive vehicles. So major decisions won't be led to you. So you can't take a major life decisions because the emotional part is very much developed and the executive part, which is like problem solving and decision making part, is not developed yet. Okay. So for that, only for that reason, we are not allowed to do certain things before you turn 18. Okay. Yes. So these are the major things. So when we come to conduct disorder is where the individuals with conduct disorder like get deviant from like behaviors such as they do deviant behaviors from their peers, which is like hurting others, doing it repetitively. Okay, so these behaviors will be very repetitive and like they are very deviant with the social norms. The individuals from their age group will be very focused with the societal norms and all. They will follow rules, but these like individuals with conduct disorder won't be able to follow all such rules and norms. Okay. So let us see the symptoms. Yes? Yes, fine. Okay. Someone from you can say the symptoms of conduct disorder. Okay? Yes? Yes.
They were more aggressive behavior towards their people or animal by hurting them, by getting them, by physical activities. They with low empathy. They don't follow the social norms.
Okay, very good. Yes. So we saw the symptoms, right? So these are some major symptoms, like 7 to 8 symptoms, which will be prominently seen in the conduct disorder individuals. Okay. So to better understand, get the concept of this, we'll see a case study. Okay. So like you have already, as of the assignment, we have already seen what is conduct disorder and its case study. So someone like tell me a case related to this conduct disorder. Yes? Yes.
So, conduct disorder, investigative conduct disorder.
Louder?
Example, subject young. He's a 13 years old boy. He's
Okay.
in 8th grade. So we can see the symptoms, the basic symptoms. He'll be hitting the things and hitting others.
Okay.
And he's hitting the parents, he's hitting the windows. And in schools, he'll be low in academics. He's bullying his friends. He's hitting his lectures. He's getting higher. Then in school, he's even hitting his parents, especially his mom. Then he's even breaking the things and everything. And their parents get to know that he's been low in academics and everything. Then later, they get to know he's bunking schools.
Okay.
Because of he's going out with his friends who are elder than him. Then he tend to take alcohol and substance. Then he has ADHD. He's been having treatment from 6 years old. So he can't concentrate more in academics. So his performance is very low in academics in schools. Then in home, his father he's been to substance abuse. So it might be a genetic thing. So he is into some alcohol abuse.
Okay. This is the case. Okay. Yes. So we all understood what the case was? Yes. So as Charkeshni mentioned all the symptoms and she gave the case and someone identified what all the symptoms that are present in this case. Yes, someone?
Symptoms like the anti-outbursts, poor academic progress,
Okay.
hurting address, destroying properties. You can see the symptoms in this case. So I think we can diagnose in conduct disorder.
Yes. Okay. Yes. Okay. We have seen several symptoms which align with the DSM, right? So we can diagnose them with the conduct disorder, and we also have some more identifications to put him with the name of conduct disorder. Okay. So we'll see how the diagnosis goes like. Okay. Yes. Someone with the diagnosis.
In home setting, social setting, like in school, he exhibits these kinds of symptoms for more than 7 months.
Okay.
So we consider him to diagnose with conduct disorder.
Oh, yes. So whenever we diagnose an individual with any disorders, there will be a specific duration. He should cross those specific duration to be diagnosed with. Like 1 month or being 1 month with the symptoms or 1 week with the symptoms won't be appropriate to be diagnosed, right? So in this conduct disorder, it should be like about 6 months of difficulties he should be facing in all these symptoms, right? Okay. So like for this disorder to be manifested, what all would be your causes? Someone? Yes?
And as his father has already consuming the substances, maybe from genetics, and he has been already diagnosed with ADHD, and it may be a component of it, and social empathy.
Okay, fine, yes. So it can be through genetics, like as his father was into substance abuse, he might have been developed with that, and some social settings like he was not properly like taught about empathetic skills, he was not developed with that. So certain some things like made him to manifest this conduct disorder, and also he had ADHD, which is being comorbid with this conduct disorder. Okay, yes. So we saw this symptoms, case history, what cause it might be, and we also saw the diagnosis of it. Okay. So let's move on to treatment. Okay. So treatment in the sense we can give him cognitive behavioral therapy. where we can teach him to we can make him to control his impulses, and slowly we can reduce his destructive behavior. Okay, which is he's making a prominent harm to others, right? So we can manage those destructive behaviors. Other than focusing on him, we also should focus on the family part, right? So his family dynamics was not proper, and his father was not proper with himself as well. So we can go with his family setting. So for this family setting, we can give a family therapy. Okay. So combining all their family members in a setting and giving them counseling and telling them this is how the symptoms exhibits, and this is how you should treat him in the home or any other setting. Okay. So and then parental management. Parental management training, what would happen in the sense, in this parental management training, he would parents will be psychoeducated with how he can be parented. Okay, so some parents will, from the younger age, they won't be much focused with their kids, right? So because of their job or any other social situations, they may not be able to control them or upbring them. So certain parenting tips can be provided to them to manage this behaviors. Okay, so these are all some treatments we can provide to the individual to manage the symptoms of conduct disorder. Yes? Okay, you all understood with the treatment part? Yes, and also to mention, he was taking medications for his ADHD. So along with the ADHD medications, we are giving therapy for conduct disorder. Okay, so which will help him to manage both. Okay, yes. So all clear with this case study?
Yes.
Yes. Any doubts? Yes.
Can it be completely cured?
Conduct disorder. Yes. So yes, sir. So conduct disorders disorder cannot be completely cured, but it can be managed with therapies, and as he also has ADHD, we can manage, and as he takes medication for that, we can maintain and manage him with the symptoms, and for betterment of life, we can provide therapy.